Let me introduce my talk in Russian. Again, good morning, everybody. My name is Aleko Khelaia. I represent Georgia National Center of Urology, and I'm the leader of male health. Today, I will talk about the energy deficiency of sperm in chronic prostatovesiculitis and epididymitis, or the inflammation of the male sex tract. I personally cannot clearly define where is the line between male and female infertility. It it always requires a complex, multifactorial approach, and Professor Sofokidis mentioned that female factor is very important. If female's age is older, we have to be in a rush. So in practice, it's always a bit different than in the textbook. This is a recent article about seminal tract infections, and in 2020, it references to the Michelak's article that says that infections have the third place in the reasons of male infertility, 11 to 15%, and I think that number is actually higher. With TNM sequencing we cannot always afford the TNM sequencing of many pathogens, and I think the infection rate is much higher. Today we've already started talking about oxidative stress, and I think it is important to define male infertility associated with oxidative stress, and DNA fragmentation is a separate form of male infertility. Asthenozoospermy, you already know that recently there was a correction of spermogram norms. The changes are not very critical, but still they're important. So this condition happens in fertile and infertile males, and really it is really hard to define which spermogram will give us a fertile man fertility and which one will give us infertility. Reasons for asthenozoospermy: we know that it could be impaired forming of the mechanical motility, but there can be also reversible problems like bacterial prostatitis. But it is important to know that leukocytosis is not always associated with bacterial invasion, and antibiotic therapy does not always give us good results. I would also like to talk about the inflammation cytokines. You see that IL-8 is in 67% higher in men with infection with inflammation. The chain reaction happens from the white blood cells. And what is the origin of neutrophils and macrophages in the seminal plasma? You can see that mainly granulocytes come from prostate, from the seminal vesicles, and macrophages come from the epididymis. What contributes to the motility of the sperm? Healthy, not inflammatory plasma, normal maturation in epididymis, low physiological level of free radicals. There should be free radicals, but they should be low, and enough molecules of energy. Carnitine that is secreted in epididymis, fructose secreted by the vesicles, and it is up to 70% of ejaculate. We know that epithelium of the epididymis should be healthy, should not be inflamed, and they need androgen support nutrition because they are very sensitive to androgens. Maturation of sperm in the ducts, they're usually there for 7 to 14 days, and you can see the spermatozoids move through epidemiosomes that provide nutrients for the sperm, And one of the natriuretic substances is L-carnitine. And you can see that delay um, while traveling through the ducts is very important. It influences the motility of the sperm and the concentration of carnitine. You can see here the tubus, caput, corpus, and cauda, and you can see in every part the carnitine level rises and motility rises. And the fertility ability also rises. It appears only in the corpus of the epididymis. There are multiple studies that show that the concentration of carnitine is 2,000 times higher in epididymis than in blood. Why carnitine is essential for spermatozoids? It improves the work of mitochondria. It substitutes the impaired, the injured parts of the membrane. It has a lot of polyunsaturated fatty acids necessary from the membrane, and it lowers the level of excessive level of free radicals, neutralizing their effect on spermatozoids. Role of carnitine in male fertility. We have this scheme. We can see that chronic inflammatory process leads to the increase in free radicals, decrease in carnitine, and oxidative stress. And it is bad conditions for spermatozoid maturity and motility. And it leads to the slowing of the spermatozoids. The second parameter is fructose, and we can see that with increase in white blood cells, fructose level decreases in seminal plasma. Another study from Vietnam that showed us that in normospermy, the concentration of fructose is lower in oligospermic men. The higher is the concentration of spermatozoids, the lower is fructose. The higher is motility, the lower is fructose. What do we mean? What I would like to say, the more spermatozoids are there, sometimes we are so happy we have 200 millions in milliliter, and we are so glad, but really they have deficit of energy. It is overpopulation, so to say, and overpopulation leads to war for resources. So it is a very interesting study that showed that even in normospermy, they can suffer from deficit in molecules of energy. Effect of carnitine on motility. Here, yeah, we can say that there is a change in differences in concentration in motility. Carnitine really affected and was really different in fertile and infertile men. Another study from Iran showed that the level of carnitine is much lower in the infertile group. Even in classical form of pathospermia, the triple form, it was even lower than in fertile men. Lowering the level of free radicals, also something that can be induced by low carnitine. The first group was men without inflammation, and the second group was group with high white blood cells in the plasma. And here we can see the initial levels. Lower here you can see the control group, and after prescribing carnitine for 3 months, free radicals are decreased in both groups, either inflammatory process or without inflammation. In both cases, have a look. When there are leukocytes in group B, their free radicals were much higher originally. A lot of meta-analysis exist on positive effect of carnitine on fertility, and I will allow myself to say a few words about the motility. You can see here the flow chart where all of these studies that were included in this meta-analysis After administration of carnitine, spermatozoid motility increased. Other clinical data on the dosing: 3,000 milligrams, not 1,000, not 1,500, 300 milligrams of carnitine for 3 to 4 months. You can see in both studies we see the improved motility and concentration of spermatozoids. Carnitine should be prescribed in 3,000 milligrams, and it is not new information. One of the first works on this was published in 1994. Today, we can, and if you dive deeper into that work, you can see that back then they prescribed 1,000 milligram 3 times a day, but now we can do 3,000 milligrams once daily. And the motility improved with every month. And in 4 months, the motility was the best. So recommendations are, first of all, good diagnosis, appropriate diagnosis. We have to know what we want. We need to eliminate the inflammatory process, and only after that prescribe energy molecules. We can use a combination of 3,000 milligrams of carnitine and 2,000 milligrams of fructose in one pill. We have this medication for many years in Georgia already, and I would like to talk about this scheme of how the sperm impairment is improved. If we prescribe carnitine with anti-inflammatory drugs, with steroids, the effect was not full, was not good enough. If we prescribe carnitine immediately before treating the inflammation, there was no effect. But if after anti-inflammatory therapy, antibacterial therapy, we prescribe carnitine after that, then it led to the best effect. Thank you for your attention.